Hey everyone, welcome back to the channel. Today we're tackling something that affects millions of Americans, but honestly confuses the hell out of most of us. Health insurance. Now, I know what you're thinking. Oh great, another boring insurance video. But stick with me here, because we're going to break down why having health insurance in America doesn't actually mean you're protected from going broke. Yeah, you heard that right. You pay your premiums every single month. You think you're covered. Then bam, you get hit with a $10,000 bill after a hospital visit, and you're sitting there like, wait, I have insurance. What just happened? Well, today I'm going to explain exactly what happened. We're diving into deductibles, coinsurance, out-of-pocket maximums, and the absolute nightmare that is surprise billing. Let's get into it. All right, let's start with the basics. When you have health insurance in the US, you're basically making a deal with an insurance company. You pay them money every month. That's your premium. And in return, they promise to help cover your medical costs. Sounds simple enough, right? Wrong. Because here's the thing. Your premium is just the entry fee. It's like paying to get into an amusement park. But then you still have to pay for every single ride once you're inside. So what else are you paying for? Well, there's your deductible, your co-pays, your coinsurance, and your out-of-pocket maximum. And if you don't understand these terms, you're not alone. Studies show that most Americans can't actually explain how their own health insurance works. Let me break it down for you in plain English, because this is where things start to get expensive. First up, the deductible. This is the amount you have to pay out of your own pocket before your insurance even starts helping you out. Let's say you have a $3,000 deductible. That means if you go to the hospital and your bill is $5,000, you're paying the first $3,000 yourself. The insurance only kicks in after that. And here's the kicker. The average deductible for an individual plan in the US is around $1,500 to $2,000. For family plans, we're talking $3,000 to $5,000 or more. Some plans have deductibles as high as $8,000. Think about that for a second. You're already paying hundreds of dollars every month in premiums, and then when you actually need to use your insurance, you have to drop thousands more before they even start covering anything. For a lot of people, especially those living paycheck to paycheck, coming up with $3,000 or $5,000 on the spot just is impossible. So even with insurance, people are avoiding the doctor because they can't afford the deductible. That's insane. Okay, so you've hit your deductible. You're thinking, great, now my insurance covers everything, right? Nope, not even close. Now we enter the world of coinsurance. This is where your insurance company says, all right, we'll help out, but you still have to pay a percentage of the costs. Most plans have something like an 80-20 or 70-30 split. That means the insurance pays 80% and you pay 20%. Or they pay 70% and you're stuck with 30%. Let's do some quick math. Say you need surgery that costs $50,000. You've already paid your $3,000 deductible. Now with an 80-20 coinsurance split, you're paying 20% of the remaining $47,000. That's another $9,400 out of your pocket. So in total, you've paid $12,400 for a $50,000 procedure. And that's with insurance. Plus all those monthly premiums you've been paying the whole time. This is why people are going bankrupt over medical bills in America. You can do everything right, have insurance, and still end up drowning in debt. Now there is one safety net here, and it's called the out-of-pocket maximum. This is the absolute most you're supposed to pay in a year for covered services. Once you hit that limit, your insurance is supposed to cover 100% of your costs. For 2024, the legal limit for out-of-pocket maximums is around $9,450 for individuals and about $18,900 for families. But many plans have lower limits, like $5,000 or $7,000. Sounds good, right? Well, here's the problem. Most Americans don't have $5,000 sitting around for emergencies. According to recent surveys, nearly 40% of Americans couldn't cover a $1,000 emergency expense without going into debt. So yeah, there's technically a cap on what you'll pay, but for millions of people, that cap is still way too high. And that's assuming everything goes smoothly, which brings us to our next nightmare. All right, this is where things go from bad to absolutely ridiculous. Let me tell you about surprise billing. Imagine this. You need surgery. You do your homework. You make sure the hospital is in network with your insurance. You check that your surgeon is in network. Everything looks good. You have the surgery. Everything goes fine. Then 2 months later, you get a bill for $15,000. What happened? Well, turns out the anesthesiologist who worked on you wasn't in your insurance network. Or maybe the surgical assistant wasn't, or the lab that processed your blood work. Doesn't matter that you had no idea, no choice, and no way to check beforehand. You're still on the hook for the bill. This is surprise billing, and it's been destroying people financially for years. You literally can't control it. You're unconscious on an operating table, and some out-of-network doctor you've never met walks in, does their thing, and suddenly you owe them thousands of dollars. Now, there is some good news here. In 2022, the No Surprises Act went into effect, which protects patients from some surprise bills in emergency situations and certain planned procedures. But it doesn't cover everything, and there are still plenty of loopholes. People are still getting surprise bills. And when you're already stressed about your health, the last thing you need is a financial heart attack on top of it. So why is the system like this? Why is American health insurance so complicated and expensive? Well, it comes down to how our system is structured. Unlike most developed countries that have universal health care or single-payer systems, the US relies on private insurance companies that are, at the end of the day, trying to make a profit. They negotiate with hospitals and doctors, create networks, and come up with all these rules about deductibles and co-insurance to limit how much they have to pay out. It's a business. And caught in the middle of all this? Regular people just trying to stay healthy without going broke. There's also the fact that healthcare costs in the US are just astronomically high compared to other countries. A routine MRI that costs a few $100s in Europe can cost thousands here. Same procedure, wildly different price tag. So even with insurance, the underlying costs are so inflated that you're still left paying a fortune. Look, I'm not here to tell you what the solution is. That's a whole other debate. But what I do want you to understand is how the system works right now, because knowledge is power. Read your insurance policy, know your deductible, understand your co-insurance. Ask questions before you get care if you can. And if you get a surprise bill, don't just pay it, fight it. Call your insurance company, call the hospital's billing department, and know your rights under the No Surprises Act. Health insurance in America is confusing by design, but you don't have to be caught off guard. If this video helped you understand things a little better, do me a favor and hit that like button. Subscribe if you haven't already, because we're going to keep breaking down these financial topics that actually matter to your life. Drop a comment below and let me know. Have you ever been hit with a surprise medical bill? I want to hear your stories. Thanks for watching, and I'll see you in the next one. Stay informed, stay healthy, and don't let the system catch you slipping.